Good morning, ma'am. For today, I'm going to do a written demonstration on the assessment of the neck. So first, we need to identify the patient, and then explain the purpose of the neck examination and answer any questions. And then perform hand hygiene and observe other infection prevention protocol. In assessing the neck muscle, ask the client to hold the head erect, inspect neck muscles, sternocleidomastoid muscles, and trapezoid muscles for abnormal swelling and masses. Okay. Inspect the ability of the patient to move his neck and ask the client to move her chin to chest and then tip head back as far as possible. Ask client to move head to each ear to the corresponding shoulder. Assess muscle strength. Ask client to turn the head to one side against the resistance of your hand. Ask client to shrug the shoulders against the resistance of your hand. Next, put on gloves. Assess lymph nodes. Palpate entire neck for enlarged lymph nodes. Face the client and bend the client's head slightly forward to the side being examined. Palpate nodes using the pads of the fingers. Move the fingertips in a gently rotating motion, starting from the pre-auricular, post-auricular, and occipital. When examining the submental and submandibular nodes, place the fingertips under the mandible on the side nearest the palpating hand and pull the skin and subcutaneous tissue laterally over the mandibular surface so that the tissue rolls over the nodes. To palpate for the supraclavicular nodes, have the client bend the hand forward to relax the tissues of the anterior neck and to relax the shoulders so that the clavicles drop. Use your hand nearest to the side to be examined when facing the client. Use your free hand to flex the client's head forward if necessary. Hook your index and three fingers lateral to the sternocleidomastoid muscles. When palpating anterior and posterior cervical nodes, move your fingertips slowly in a forward circular motion against the sternocleidomastoid and trapezoid muscle respectively.
To palpate the deep cervical nodes, bend or hook your fingers around the sternocleidomastoid muscles.
In assessing the trachea, palpate the trachea for lateral deviation.
Place your fingertips or thumb on the trachea on the suprasternal notch and move your finger laterally to the left and the right on the spaces bordered by the clavicle, anterior aspect of the sternocleidomastoid muscle and
Check location of carotid artery. Inspect and palpate the left and then the right carotid arteries. Only palpate one carotid at a time. Use the bell of the stethoscope to auscultate the arteries for presence of carotid growth. In assessing the thyroid gland, inspect thyroid gland, stand in front of the client and observe the lower half of the neck overlying the thyroid gland for symmetry and visible masses.
ask the client to extend the hand and swallow. Offer a glass of water to make it easier for the client to swallow. This action determines how the thyroid gland cricoid cartilage move and whether swallowing causes a blockage of the gland.
Remove and discard gloves and then perform hand hygiene. Document findings in the client's record.